Setting: Community Health Center. You see a 50-year-old patient who has been referred for an ECG because of the chest pain. You explain the procedure before beginning. Now let's see the task. First one says, find out the reason for patient's visit. Second one says, find out how patient is feeling now, chest pain, anxiety, and check if he has done the procedure before. Third one says, explain the ECG procedure. Removal of clothing from waist up, need to lie almost flat, attachment of electrodes to arms, chest and legs, connection to ECG recording machine, printed graph of activity, completion in few minutes, resist request to interpret ECG result, outline result process, immediate analysis of graph and discussion by doctor. Fifth one says, reassure the patient about the ECG, painless, possibility of slight discomfort during the removal of electrodes. Sixth one says, explain the functions of ECG, measure the heart rate, irregularities and palpitation. Seventh one says, advise the patient of possible need of further test dependent on result, doctor's decision. Eighth one says, check if the patient is wearing any jewelry or carrying any mobile phone. Ninth one says, establish patient's consent to begin the ECG. Now let's begin the role play. Good morning. I'm Catherine, one of the registered nurses working in this community health center. Please be seated.
Good morning, nurse. Thank you.
Can you please tell me your name and age for verification?
My name is Isabel and I'm 50 years old.
Okay, Isabel, I understand that you have been referred to have an electrocardiogram today because of chest pain. Am I right?
Yes, nurse. I've been experiencing chest pain and some other discomfort for the past few weeks. Therefore, my doctor advised me to do the test called ECG. However, I did not have any idea about the procedure. So, can you please elaborate me more about the procedure before beginning it?
Okay, Isabel. I'm glad to explain you that in detail. Before moving further, may I ask you some questions regarding your condition?
Sure, nurse.
Do you have any symptoms like chest pain or anxiety?
Yes, nurse. I've been experiencing these symptoms for quite a long time. That is why my doctor advised me to undergo the test, as I told you initially.
Okay, Isabel, I understand that. Have you ever done the electrocardiogram before?
No, nurse. I've never done this procedure before. This is the very first time I'm going to undergo this procedure, so I'm a bit nervous.
Please set your mind at ease, Isabel. Try not to be worried. I can provide you the complete information regarding the electrocardiogram.
Yes, nurse. Thank you.
Okay, Isabel, I will explain what an electrocardiogram is, its functions, and the pre-requirements along with the result. So you can ask me any questions at the end of it. Is it okay with you?
Okay, nurse.
First of all, let's see what an electrocardiogram is. An electrocardiogram is a test that measures the electrical activity of the heartbeat. It is one of the simplest and fastest tests used to evaluate the heart. That is, it measures the heart rate. Moreover, it will help us to understand if there is any irregularities or palpitation. Okay, Isabel, I hope you're following me.
Yes, nurse. Can you please let me know how are you going to perform this procedure?
Isabel, your thoughts are really appreciable. I will explain you the ECG procedure in detail. On the test day, you'll be asked to remove any jewelry or other objects like mobile phone that may interfere in the procedure. If your chest, arms or legs are very hairy, the technicians may shave or clip small patches of hair as needed so that the electrodes will stick closely to the skin. Then you will be asked to remove clothing from the waist up and you need to lie in a flat position on a table or bed for the test. Then the electrodes will be attached to your chest, arms and legs. Then lead wires will be connected to the ECG recording machine. Then the electrical activity of the heart is measured, interpreted, and the result will be printed out in a graph which shows your heart activity. It is done to check your abnormal heart rhythm. So the test enables your doctors to plan your surgery or the treatment required. I hope you understand me.
After the test, will you be able to discuss the result with me so that I can understand if something is wrong with my health condition?
I understand your anxiety, Isabel. However, I'm not the authorized person to interpret the result with you. For that, you can meet the doctor and discuss the result for the same day of your electrocardiogram. Is that okay with you?
That's great, nurse. Will there be any sort of pain during the procedure?
I can sense your worries, Isabel. Do not worry. An ECG is a quick, safe and painless procedure. No electricity is put into your body while it is carried out. However, when the ECG electrodes are removed, there may be some minor discomfort, but I can assure you that you can resume your normal activities after your electrocardiogram. Are you clear, Isabel?
Yes, nurse. Thank you.
Isabel, as I mentioned to you before, after the procedure, the doctor will explain you the result in detail. After analyzing the report, the doctor may ask you to do another ECG or some other diagnostics test if the result shows any abnormality. If the ECG is normal, you may not need to do any other test. However, it will be completely dependent on the result and your doctor's decision. Okay, Isabel, do you have any questions?
No, nurse.
Okay, Isabel, apart from that, as I told you before, it is important to remove your jewelries and mobile phone before the procedure because it may misinterpret the ECG reading or interfere the procedure. So, is it okay with you?
Sure, nurse. I can do it.
Finally, do you have any more questions?
No, nurse. I'm very much clear now. Thank you very much.
Okay, Isabel, can I have your consent to begin the ECG procedure?
Sure, nurse. We can proceed to start the procedure.
Thank you, Isabel. So far, we have discussed the electrocardiogram, its function, and the detailed procedure. I hope you understand that. Now you please relax here. I'm going to make preparations for the ECG procedure. In between, if you have any more concerns, you can ring the buzzer which is near to your seat. Then I will be here to help you. Thank you, Isabel. Wish you a great day ahead. Thank you all. Our role play and see you.